Hi, I'm Dr. Johnny. Thanks for joining me today. I did a community post the other day on which celebrity you guys wanted to see me go through, look at their beauty, and determine what surgeries, what aesthetic procedures maybe they had done or didn't have done. And we had a few on there, including Kendall Jenner. I think we had Madonna on there. Bella Hadid won out. So we're going to look at Bella and talk a little bit about her aesthetics. She has never come out, as far as I know, and said that she's had anything done. She comes from a background of a successful father who's in real estate. Her mother was also a supermodel. And she started when she was young, so around 16 years of age or so. She's about 24 now. And a lot of times changes in the face can occur from bony changes, from fat, and gain or loss of weight. So we're going to look at that and see, hey, could some of it be bony changes? Is it surgery? Do we think it is? And also, most importantly, and I think most applicable to people watching, is the educational point of view, because so much of what we're doing with beauty and what your aesthetic physician, plastic surgeon, doctor, injector is looking at are angles. And a lot of people come into clinics with preconceived ideas of what they need done, of what would look good. And the injector, the doctor's sitting there looking, going, I don't think that that's a good idea for you to do that procedure. I don't think that that's going to look good. It'll be too much, especially lips and things. When people get lips, of course, as all my lip videos I show you, I'm looking at the downturned mouth, the chin projection, the nose, and the side view before I even look at the lips. One of the things we're going to know about Bella, we're going to look at, is her facial angle. And I went over the beauty facial angle. Not a lot of people seem to talk about it, but that anterior tilt to the face that creates beauty. And I did that in a video, what do we call it? Get facial angles, get famous. And to go back, and I'll put in the below in the description, I'll put a link directly to that video so you don't have to go find it. But that's going to be another one. We looked at, I think, Shiva Nagar, and she has that beautiful angle, and I'll show you that here. There's common denominators in beauty. We're calculating these angles without even knowing it. Someone comes in and you see them, you make an impression in your mind about that person right away. A job interview would be a classic. People are determining, do they want to hire someone? And they'll call it healthy. We determine someone's health when we look at them. We look at their eyes. Do they look tired? Is their skin sagging? Do they seem to have low energy? Or are they upbeat, full of energy, look youthful, look like they're going to come to work with a lot of energy? We make these judgments on people walking down the street. Even someone's stature, we look at their age. If someone's hunched over as if they have back pain or they got a bit of scoliosis to the spine, that says age, and we calculate their age based on that and light reflection. One of the things when we look at her, I want you to think about, because a lot of people come into us as providers of aesthetic services and say, I want to look like Bella Hadid. I want Bella Hadid's lips. I want the Bella Hadid brow lift. I hear it all the time. And we're going to go through that today in facial angle, but it drives practitioners crazy because they know a lot of it is makeup. We're going to look at her eyes and determine what we think of that. But I think it's important to look at those angles and to know them and determine what it is maybe we should and shouldn't do. So let's go, we'll look at her on the monitor now. Remember, if you like these videos, it's important to click the like, helps us with the algorithm, helps me know what you want to see in the future. Subscribe, click the subscribe button, just smash it now, and there'll be a bell. And if you click that bell, you'll be alerted when all my new videos post, and you can be one of the first to watch all the things that keep your skin and body beautiful, healthy, and vibrant. And to remember, these people do it for a living. And if you go to Hollywood, if you're in New York, if you're around these people, they say, well, how many treatments do they get? This is their job, to wake up and take care of their skin, their look, their makeup, their eyes. And it'll be nothing for every week to 2 to 3 to have some procedure done. So if you're trying to emulate that as regular people as we are, understand it's a full-time job. Let's go to the monitor. Let's see what we can educate ourselves with on Bella Hadid's look from before until now. So if we take a look at her just in general, I wanted to show you that anterior projection of the face that I find is just a common denominator amongst attractive people, amongst models of the world, and it's a good look. Chin implants and chin fillers are all the rage, and it's probably one of the reasons why. But if you look at a picture, her face is just slanting forward. Now, golden ratio is 1.61 to 1. There's dozens of them on the face. So we can get into calculating them. That would be a video unto itself. However, you can look at, on the video I did about Get Facial Angles, Get Famous, we talked about drawing a line from the limbus of the eye down that gives the width of the mouth. She has a smaller mouth relative to her face. However, her masseters aren't wide. And that's one thing we're going to talk about is the jawline. I want you to pay attention before we move on to pictures. The canthal tilt, the eyes, the cat eye, everyone wants the Bella Hadid Brow Lift, okay? And that's why the canthal tilt, it's accentuated by her bones, her natural anatomy, and look at her brow shape. And we're going to see some older pictures and you'll see how the brow shape has evolved. And you can look at her nose. Look particularly at the upper lip in this picture. The upper lip is larger than the bottom. I always probably talk about the 1.61 to 1 golden ratio that I don't believe in for the lip. And a lot of people believe firmly that it has to be that. She's not only 50-50, which I have a whole video on get a wide mouth. Okay, how to make the mouth wider. And remember, the masseters, the wider the masseters, the wider the mouth can be. Think Angelina Jolie type masseters. However, she is more volume on the top than the bottom, which is a look. So here's another look, and this is before, and this is more recent. One of the things we can see now, she's smiling in one picture and not in the other. So it's hard to compare. It's really hard to get people with the exact same look just randomly, but you can extrapolate a few things. One is the cheek volume. So the cheek, if you see in many pictures, and one we're going to look at, a high defined cheek, contours and slims, okay, narrowing of the masseters, which is possibly what could have happened. Doesn't have to be done with surgery, but botox in the masseters can help slim. Fillers can help define the jawline. And of course, the lip volume here, you can see a big difference, even though she is smiling. One of the interesting things is if you look at the cheek here, a lot of times, unless people gain weight, we don't get a lot of anterior cheek volume that's lifted like this. Now she has a little bit of a smile. When we age, normally it sags down, and if people are thin, typically models have a more of a gaunt look or less volume, whereas here I'm noticing more volume and a defined apple. And that's a thing for people coming into clinics. They want a lot of apple. I like the high contoured cheek look that we're going to see in another picture. So as I look at this, I look at starting in the top down, the brows. I don't believe she's had any canthal tilt surgery. Only several people in the world really do it well. A lot of people, if they come in for canthal tilt surgery, would send you away, say you're crazy. Now you can do barbed threads, you can do smooth threads above the brow, you can do neuromodulator. I have Botox brow lift videos. That can be done. But surgery to tilt the eye, very unlikely. If we come down, nose surgery, rhinoplasty is one of the most common surgeries of anyone in Hollywood. And you can see changes in the nose. Could it be makeup? Makeup can do wonders. But one would wonder about something done in the nasal region, and from some other pictures I've looked at too, would make you wonder. Lip volume, you can overfill or put more lipstick on the top lip or the bottom lip. In this case, is there more lipstick? You be the judge. There certainly seems to be a little more volume in the lip, and from other pictures too, like the first one I showed you, makes you wonder. Narrowing of the jaw and an accentuated jawline. People get surgeries, and in some countries they shave the bone down. Particularly, you think South Korea, they shave the bone down commonly to narrow the face. Asians do not like that square look. But certainly, could it be changes with age? We're going to look at another picture now, but the bones of the face do change as we age, and I think some of what we're seeing may also be the bony and the fat changes from youth to now. So let's go to another picture. So here's 2011, 2014, and 2018. And if we look at these pictures, there are a lot of actual similarities. The nose does seem a little different. Again, slimming of the jawline from 2011 to now. That could be bony changes, but it could also be, like I say, Botox, fillers, chin projection. I showed you that anterior tilt. I'm not imagining a lot of anterior tilt here. A lot of times the bone does not change to favor anterior tilt. The chin does rise, but that's more 40s, 50s, 60s, menopause, estrogen loss. You get that. So some people say the only thing that lifts, doc, or that's lifted is my chin, and they get the chin crease. Everything else droops. So the chin does lift. You see more of a mental crease here and more here, to my point. So again, look at the brow shape, that Bella Hadid brow lift that drives surgeons crazy because they come in asking for it. There's ways to do it. Makeup is your number one. Botox or neuromodulator brow lift, smooth threads above the brow. And certainly barb threads can be good. They're more invasive. They don't last forever, but as you build collagen in an upward manner, I've seen nice results, but it's a thing. And you see, come for $1,000 or $2,000, get the Bella Hadid brow lift. That's not my shtick per se. I'm looking more like long-term things. But one thing that will lift it nicely, and remember, as we age, the eye rotates and the brow wants to go down, is Sculptura Plasma Sculpt up in the temple into the hairline to lift that whole complex. And then look at the lip volume. Again, I just see more lip volume here. Lip volume does not increase as we age. It decreases from the early 20s on. So we would expect decreasing lip volume that we don't see. So the eyes, likely minimally invasive procedures. The cheeks, certainly there seems to be some contoured filler. The lip seems to be getting more volume versus less. The nose seems certainly a different shape, narrower and changed. And to the chin and jawline certainly is changed and could be something minimally invasive going on down there if it wasn't the bony changes. So thanks for joining me. Let me know what you think. What celebrities do you want to see? What's your thoughts? What has she had done? What don't you think she has done? And do you get upset when celebrities say, I haven't had anything done, and those that you know obviously have had something? Join me here. Keep your skin and body beautiful, healthy, and vibrant.